Welcome back. 9:14 now. Developing this morning, the U.S. expected to see another 100,000 coronavirus-related deaths by December. However, health officials say that number could dramatically drop if more people start wearing masks in public. So far, roughly 51% of Americans are now fully vaccinated. The surge has really put a strain on hospitals and, of course, the staff there. A nursing shortage is also impacting hospitals across the country and here in Central Florida.
There was a nursing shortage before the pandemic, so it's actually been exacerbated by the pandemic. It is super stressful. You go home not knowing if you did everything right.
Well, local nurses on the front lines are sounding the alarm as well. The long, emotional days are getting the best of many of them. And joining us right now to talk more about it is one of those local ICU nurses, Haley. Good to see you, Haley. How are you?
I'm good.
Talk to me a little bit about what it has been like since the resurgence of the Delta variant. And obviously you guys are in a situation now where you have beds that are full almost all the time.
It's constantly full. We don't see a time where you don't have an empty bed for very long. It's taxing because you constantly have to be on your guard. You're bouncing one patient from the next patient who are all critically ill. And from one moment to the next, you can have somebody crashing in one room and then the next room starts to crash right behind them. So it's very taxing.
Talk to me about what you and the other nurses talk about in your downtime, if you even have downtime. But I'm sure you at least have opportunities to catch up with each other.
A lot of it's emotional. So we try to make sure that we're doing okay. A lot of us, on the side, our lunches, we ask how their day's going. What can I help you with? How are you feeling about today? I mean, sometimes just that emotional backup that we need from each other because, we're all going through it. We're all seeing it. And it's hard for all of us. So we're just there mentally to support each other.
Do you worry for your own personal safety and your own health?
I mean, right now I have coronavirus. So yes, I'm very sick and every day's different. So, sorry, but every day is different. So one day I'll feel good, the next day I'll feel terrible. So, I'm concerned about family. I'm concerned about my son, my family, my kids, my daughters. Of course, I want them to stay safe.
What is your current situation, Haley? Are you kind of locked in your room and then people are bringing you food and drink as you need it, or how's that working?
So originally it started with my husband, who was locked in our bedroom. Unfortunately, my son was already exposed, and at that point I had cared for him after he had been exposed. So we're all kind of quarantined in our house. We all three have it, so we're just kind of going through it together. My daughters are luckily at their grandmother's house, so away from the coronavirus.
Oh gosh, that's awful. We're all praying for all of you to hopefully start feeling better soon. Haley, getting back to how things are at the hospital, are you hearing these mumblings of people saying, I can't do this anymore, if this isn't over soon, I'm gonna have to quit? What is sort of the mental overall health of the nursing staff?
So every day, we're constantly saying, okay, I can't do this anymore. Mentally, it's too hard on us. But we do it because we have to. That's our job. We love our patients. We want to help people. My nurses on my floor, we're not leaving. We're in it for the long haul. Some nurses are going for traveling because they're making more money. Some nurses are, getting sick and they can't do it. But the nurses that are there, that they're too afraid to call out sometimes because we'll be short. So it's hard because you're there with your second family basically.
Aww.
So we're all supporting each other.
Wow, God bless you. And Haley, we sure hope you and your husband and your little boy are all feeling so much better soon. And please take care and keep us posted, okay?
Okay.
Thank you for all you do.
Thank you.